How is the PAD revascularization procedure performed? Who does it?
So the PAD revascularization procedure is performed by a physician who's specially trained in performing these procedures. We work with many proceduralists, expert physicians on PAD. They come from many specialties, three specifically: interventional cardiology, vascular surgery, and interventional radiology. We have proceduralists from all three specialties, and they are excellent. We only hire and work with the best. These physicians have expertise in PAD revascularization. It's a very high-end procedure, particularly below the knee disease and below the ankle disease. You see, the arterial system above the knee, pretty wide diameter vessels, 8 millimeters, 7 millimeters. There's a lot of physicians that can do revascularization procedures in vessels that large, arteries that large. Below the knee is where you separate the men from the boys, so to speak. The arteries get significantly smaller, the anatomy gets more complex. However, that's required. As you can imagine, whether you're a patient or a referring physician, if your arteries in your right leg, say, are occluded all the way down from your groin to your ankle, and you have a big ulcer on your right lateral ankle, if we were to just revascularize your arteries in your right leg above your knee, well, that's good, but what did it do for the blood flow below the knee on your right leg or for the ulcer? Very little, right? So an above the knee SFA angioplasty doesn't really do much. You need the expertise as a business and a proceduralist to be able to go safely below the knee, assertively, appropriately, but safely below the knee, and open up those small arteries, specifically the ones that need to supply arterial blood to the wound, to the ulcer. Otherwise, it's not going to heal. So, who does the procedure is an expert PAD proceduralist from one of these three specialties. All who work with us are experts in the procedure. They know very well what they're doing. How is it done? Well, the day of the procedure, you come in, we prep you, we give you an IV in your arm, in your vein, it doesn't hurt much. We give you sedation. You meet the procedure team, you meet the proceduralist, you get to speak to him. Then we give you sedation, then you go to the procedure room. You won't remember any of this. At that point, they will inject some lidocaine in your groin, and they'll enter your artery through a tiny hole in your groin, about the diameter of a pencil or even a little bit smaller. Once we're in the arterial system, you don't feel anything. We can drive around. All your arteries connect, like roads and avenues. You don't feel anything. You're sedated. But we can use fluoroscopy and ultrasound to see how your arteries look from the inside. And if they're occluded, if you have peripheral arterial disease, as we suspected, based on our evaluation, then we can do various things on the inside of your artery to open them up and to restore blood flow. Again, you won't feel any of this. A procedure generally takes about an hour, give or take 15 minutes. After that, you go in the recovery area, you'll wake up, you won't remember anything, you'll be a little mentally groggy. You might have a little bit of soreness in your groin area, but nothing too bad, just like if you get a shot in your arm, something like that. And then you hang out, we'll give you some food, you're gonna be hungry, you wouldn't have eaten all day. And then in about 2 hours, once you're mentally okay, your groin's okay, you can go home. You'll be able to walk out of the facility, you'll have a friend, family, loved one, or transportation that we helped arrange to take you home, and you're pretty much gonna be back to normal. Not a long recovery. If you work a sedentary job, you can go back to work the next day. If you work a strenuous job, say you lift heavy boxes, you should wait a few days until your groin heals. But it's not gonna be a long multi-week or multi-month recovery. So the procedure's outpatient, you're in the facility 3 to 4 hours. The procedure itself is in the middle of that, about an hour, done by an expert PAD proceduralist who we work with. So you'd be in good hands with us. If you have wounds and or leg pain, give us a call, have your referring physician send us. We would love to schedule you for an evaluation.